Welcome to Gold Soul, where empowered parenthood and conscious living meet. I'm Jessie, a licensed home birth midwife, here to explore birth, parenting, and personal growth. Through real stories, reflections, and chats with holistic experts, we'll uncover fresh insights, heartfelt support, and a bit of humor. Let's laugh, learn, and grow together through the beauty and challenges life brings. Hello, welcome back to the Gold Soul podcast. Today, I'm so thrilled to have this amazing human join us. This is Whitney with Restored Physique. She is a phenomenal pelvic floor physical therapist, lactation consultant, and she wears many hats. So let's dive right into it. Whitney, do you mind giving us a brief introduction to yourself and why you became a pelvic floor physical therapist?
Yeah, so I have been a pelvic floor PT now for almost 15 years. So it is just my passion. I love what I do. And then I went into some of the lactation stuff probably about 7 years ago after I started helping moms with clogged ducts and mastitis with ultrasound. And so I actually kind of fell into this career. I am from Wisconsin. We're big into our football. I thought I wanted to do like sports PT, ideally for a football team. And when I went to school, the first semester I started practicing on my husband, and he's a big guy. And I quickly realized I am way too petite to be handling like big guys. So I had a little breakdown, and my advisor was just like, stick it out this first year. There is so much more to PT than just sports. And so this was like 17, 18 years ago. Pelvic PT was barely a thing back then. And so my second semester, we had someone come in who gave us like an intro to women's health, and I loved it. And I was just like, okay, maybe this is what I'm going to do. And we had 3 lectures in the 3 years of the doctorate program on women's health. And I was just really lucky. We were out in New York at the time. I started at like a newer pelvic PT clinic in Midtown Manhattan, and I just like jumped right in out of school. So it's been so cool. I love it.
That's incredible. So I feel in my experience, even though pelvic floor PT has gained a lot of popularity and is becoming something that people are more aware of, I do feel a large part of that is just within my community as a community-based home birth midwife. And I notice that when I talk to those that go the more traditional hospital route, or have already had their babies a few years ago, they kind of look at me sideways when I start talking about pelvic floor PT. So for those that are not aware of what it entails, can you kind of walk us through what a typical session is like?
Yeah, yep. And it's going to depend a little bit on what's going on, but for the most part, most things that we're treating, it's going to be pelvis related. So it's things like peeing your pants, pelvic organ prolapse, pain with sex, diastasis, separation of the abdominal muscles, scar tissue, constipation, and any type of pelvic pains, pubic bone pain, low back pain. Low back pain is a big one. And so in a typical session, now I'm a very manual PT. I am hands-on because I think that's the most accurate way to actually find out what your pelvic floor is doing. So normally we'll do the intake, kind of figure out, all right, what are the symptoms? I'm doing all of this like, I guess like figuring out what I'm expecting to find based on symptoms. So I'm always kind of getting just anticipation of what I'm going to need to focus on during the session when we're going to start with the evaluation and treatment. And so most often we are going to do an internal pelvic floor exam. There are some instances where we do everything externally, but a lot of times most people want and need the internal work because we don't know what's going on down here. We're not that familiar with this area of our body, and so most people need to know, okay, what's my pelvic floor resting tone? So we're pressing on the muscles to see. Sometimes people have too much tension, and we need to get that out. Sometimes people have great tone, but they're super weak. And there's no way that you're going to know that just by looking externally or just by telling someone, oh, do a squeeze and do a relax. Did you feel that? because most people have done that and they don't know what they're feeling. They're like, well, I've tried Kegels, so I don't know if I'm doing them right. And I've seen plenty of people where they're not doing them right, like not even close to right. And so getting an internal exam is how you're going to really know what's going on with the pelvic floor. In addition to that, we're checking everything else around the pelvis too. So pretty much everything from the ribs to the knees attaches to your pelvis. So I'm doing a lot of work on the thighs, the glutes, hip flexors are a big one, the abdominal muscles, the diaphragm. I also do visceral work, so that helps with fertility and some of the different bladder and bowel conditions. So visceral, that's just organs. So we're checking how is the organ moving and making sure that we've got nice mobility there. We'll also take a look at posture, teach some body mechanics. So there's a lot to it. And then depending on what we find, then I give homework based on that.
That's incredible. I mean, right out the gate, I mean, I already know you. I've worked with you personally, but for someone who thinks that pelvic floor PT is, specific to pregnancy or to postpartum, I mean, right there you've touched, I didn't even know that you did fertility work. That is phenomenal. It sounds like everyone could benefit from it. So obviously we're talking more specific today about pregnancy and birth preparation and postpartum. So how does pregnancy affect the pelvic floor, and what are some of the common issues that you hear people experiencing?
Yes, so with pregnancy, of course, we all know that the belly's getting bigger. There's more and more pressure from above. So that's a lot of pressure down on your poor pelvic floor and all those organs. So that's going to impact the pelvic floor. But what I think makes even more of an impact is some of the hormonal changes during pregnancy, because we know that our pelvis becomes more lax. We want it to. So that's the ligament laxity that we get from relaxin. We need that for birth, but that happens and it starts during pregnancy. Some people find out that they're pregnant because they start getting some back pain, and it's because these bones back here are just starting to shift and shear because now they don't have that ligament stability. When that happens, then sometimes the muscles around the pelvis start to overcompensate and they can get too tight. So we can see a lot of tension that can start during pregnancy, both in the pelvic floor, but I see it big time in the inner thighs, the glutes, some of the muscles at the top of the glutes, your gluteus medius. It's one that's responsible for keeping our pelvis level while we walk. So some moms are waddling, not because they're just so big from pregnancy, it's because those glute medians are too tight and then they get weak there, and so they can't control the pelvis with walking. And sometimes just some releasing along the glutes, gaining some of that strength back, will get rid of the waddling. So everything around the pelvis is affected by pregnancy. And then the big symptoms, so peeing your pants, so coughing, laughing, sneezing, that can start during pregnancy. We've got all this extra pressure from above. So I say if we think of our trunk like a tube of toothpaste, the pelvic floor is the cap. If we've got extra pressure around that tube of toothpaste, we better have that cap on tight in order to keep it in. So you add a sneeze or a cough or a laugh, and that's a big pressure down. And so if your pelvic floor doesn't have the strength to control that, maybe it was enough pre-pregnancy, but now there's more pressure and it can't handle it. The other thing is our urethra can get a little more mobile with all of the laxity too. And so that then requires more muscular strength and stability to be able to stop the urine from leaking from that too. So leaking is a big one. Constipation during pregnancy is super common. Sometimes that's more of a hormonal thing and slowing of the intestines, but sometimes that can come from pelvic floor tension as well. We can have outlet constipation where these muscles are too tight, or maybe you can't relax the muscles. Pain with intercourse, that's a big one. So pain with any type of penetration is never normal. What else? Pubic bone pain. So symphysis pubis dysfunction. This can be a really tough one because it can be really hard to walk, get dressed, roll in bed, get in and out of the car, because every movement you make, these bones are shearing because we don't have that stability, and we can also get some of the muscle tension, and so that can cause pain in the pubic bone. The SI joints, so back pain is another big one during pregnancy. Prolapse, so that is where the organs are starting to fall down. It's not a great one, but that can be from all of that increase in pelvic pressure as well. During pregnancy, we don't see that as often. We'll see it more postpartum, but if there's a genetic history, like a mom, a grandma, a sister who has it, or maybe you have like a lot of hypermobility, or you're double jointed, those can put you more at risk for that type of thing. So there's lots of things we can do to prevent that. And then I would say the other big one is diastasis. So that's the separation of the abdominal muscles. Of course, as our belly's getting bigger during pregnancy, those muscles have to go somewhere, and so they will start to separate, and a little bit of separation is considered normal. But we can really prevent like a really significant diastasis just by doing myofascial work on your belly. And so that's one that I teach all of my pregnant moms of, all right, let's just start doing some myofascial release. This is something you'll do at home every day. Everyone loves that one because it feels so good. And then it typically makes it more comfortable as baby goes through growth spurts. They don't feel as itchy. They don't feel like it's tearing in the middle. And so that would be the other big one that I see during pregnancy.
It's amazing. It's almost like all of the large pregnancy complaints that we hear about are somehow connected to all of those shifts involving the pelvic floor. So what's the best way? And obviously, depending on symptoms, it's going to differ, but what's the best way overall that you find helpful to prepare for birth?
Yeah, so I would say we want our pelvis loosey-goosey. Ideally, we want everything symmetrical. I love prenatal chiropractic for getting the pelvis in a nice symmetrical position, but we also need all the muscles around it to be symmetrical too. And so I think gaining muscle balance is really important. And so if you have tension at the inner thigh on the right side and maybe the glutes on the left side, like we need to soften those muscles. If you press into any muscle, it should never be painful or tender. So we can get knots in any of these muscles, including the pelvic floor. So we want to have nice mobility of all of the muscles that attach to the pelvis. So again, that's like rib cage to knees. Everything needs to be nice, soft, flexible. So we want all of that symmetry there. Sometimes I'll have people do the massage gun or foam roll or heat, things that help promote muscle relaxation. And then we need stability. So we also need to make sure our pelvic floor can engage. Our transverse abdominis, some of the abdominal muscles can engage to stabilize our pelvis throughout pregnancy. For birth, we don't want to be squeezing our pelvic floor as our baby's coming out. So if we go back to that tube of toothpaste, we want the toothpaste to come out. And so when we pee, poop, or have a baby, we want that cap off. So we want to be able to relax those pelvic floor muscles, and we want really good flexibility of those muscles. So I think especially towards the end, but even earlier in pregnancy, a lot of times I love starting with my moms right when they hit that second trimester, so we get a good baseline of, all right, what are your muscles doing? Are there things that we need to start practicing now? Some people have no awareness of the pelvic floor, and they're walking around with all this tension all the time. And so if we're tense all the time, we need to learn how to relax those muscles, because that's going to be most important during birth to decrease our chance of tearing. And so finding out or figuring out how to get that relaxation, practicing that relaxation. And then I do think perineal massage or perineal prep can be really helpful. You have to do it right. You have to do it consistently. The research on it is mixed about whether or not people think it's actually effective. I think it is effective when done adequately. The thing is, if you're just going in and you're sweeping back and forth for a minute and you do it once a week for a few weeks, that's not going to do anything. You wasted your time doing that. So we need to have the consistency, and think of it like any other stretching exercise. The first time you ever do yoga, or you just do a forward bend and you try to touch your toes, the first time you ever did that and your hamstrings were tight and you could barely reach past your knees and those hamstrings were on fire, if someone pushed you down to touch the floor, those hamstrings are probably going to strain. That's a tear in your hamstrings because those hamstrings had no flexibility. Now, if you're doing that stretch every day, every other day, you've been doing it for a few weeks, you're noticing, all right, I can reach closer and closer to the floor. If someone did that same thing and pushed you down to touch the floor, you're still going to feel a big stretch on those hamstrings, but now they have that length and flexibility, so they're much less likely to strain or tear. That's the whole point of doing perineal massage. So what I have my moms do is they're doing trigger point release on each of these muscles to get that strength or the flexibility, and trying to get that softness in the muscles, so that then when it comes time for them to be put on like a really big stretch, which is what happens during birth, then they have that give to them, so they're less likely to tear. So that's a big one. The other, I think that's part of the equation. Another part of the equation that we have control of, which I touched on, is we also need to be able to relax the muscles. If you're tensing those muscles as the baby's coming out, a tense muscle that's then forced to lengthen is going to tear. And so if you're relaxing a muscle and then it's put on that big stretch, that's much less likely to tear than if it's shortened and contracted. So I think those are two of the big things for prepping for the pelvic floor in particular to decrease the chances of tearing.
I love that you talked on the perineal massage because I get asked about that all the time. And it's amazing how few people really understand the purpose of what we're doing and how to properly do it. I mean, you even look at old birthing books and, they have these diagrams and it's like literally telling you just to put your fingers in, lubricate it, and to push and pull down. And I've learned so much from you about those trigger points, and the focus isn't so much like trying to stretch tissue rather than relaxing. And I think once you taught me that, it was like a light bulb moment of, oh my goodness, that makes so much sense how working from inside impacts the exterior. So I love that you put such a focus on that. So postpartum, obviously I feel like more people are aware of postpartum concerns or issues related to pelvic floor than prenatal, or how we can, be proactive prenatally to avoid or try to minimize those things postpartum. But there's a slew of postpartum things that you hear about, that I hear about. What are the most common ones that, we talk about, or we see, we hear, and how do you help people either prepare for those, or once they're already in postpartum, begin the healing process of that?
Yeah, so pretty much all the symptoms postpartum are all the same ones that can happen prenatally. So we've got the incontinence, so the leaking, we've got the prolapse, we've got pain with sex, we've got the back pain, pubic bone pain, diastasis. So we've got all the same symptoms, except now we also might have the added layer of scar tissue. And so scar tissue wise, you have scar tissue if you had any perineal tearing or episiotomy. There is scar tissue there. And then obviously with a C-section, we have scar tissue. And so we need to really work that scar tissue if people have had the scar tissue. Now, things with scar tissue, if we did all the prevention work during pregnancy, a lot of times we can prevent perineal tearing. And obviously C-sections, there is sometimes cases, there are cases that might need a C-section. In general, most of the time we shouldn't be needing a C-section. But With prevention wise, we're just trying to get this pelvis to be able to move so that baby can come down into the position we need them to get into. So that then these pelvic floor muscles can be nice and flexible so baby can come out more easily. And so keeping that symmetry around the pelvis is one of the things we can do to try to prevent potentially going into a C-section. Diastasis, again, we can prevent a lot just by doing the myofascial release on the belly during prenatal. I normally do the appointments. I have a great video of me doing it on my very pregnant belly. So I always send that to my moms of like, this is how you do it. You'll see my very pregnant belly. This is exactly how I did it every single day. And so that's one of the things that we can do to prevent things prenatally. And then with treatment, so postpartum, we are doing all the same things as what we do during pregnancy. And so we're checking everything internally. We're doing all the myofascial release on the belly. I'm doing a lot of visceral work, so with prolapse and maybe the organs falling down. Urinary urgency, frequency, those are actually other symptoms. Constipation, those can all be worked on through some of the visceral work too. And then posture and body mechanics, I mean, that's one. It's so important during pregnancy, but then postpartum, it's another big one because moms are tired, they're feeding, they're hunched. They're also typically really arched, so especially in standing as we're bouncing our babies. So posturally, we need to be correcting some of that. Body mechanics when we are lifting our babies and all of the things that the babies come with. We need to make sure that we're engaging our pelvic floor, our abdominal muscles, so we can stabilize and not have pain. So back pain is a really common one postpartum. It's interesting because a lot of moms and a lot of my patients aren't seeing me purely because they have back pain. I am known for pelvic floor, and so they're coming typically for me for some sort of pelvic floor, pregnancy, postpartum related thing, but they also have back pain. And as we're working on everything, so many of my moms are like, my back pain went away. I did this and this and this and this, and nothing has ever helped my back pain, and my back pain is finally gone. And it's because nobody considers the pelvic floor as a really important contributor to low back pain. So that's another big one. That pelvic floor could be a driver to that.
That's amazing. And talking about the postpartum period, and I'm really eager to jump into the next segment about myths and preconceptions and whatnot, but prolapse is one of those things where I've personally contacted you a few times about patients to pick your brain on it. And it's always so fascinating to me about the approach you take on really allowing the body to heal in that fragile and vulnerable state of that immediate, first 6 weeks of postpartum. Can you kind of talk a little bit about what's going on there and why it's recommended to take a more hands-off approach? And I know that obviously with any concerns of prolapse, we have to address it as a case-by-case situation. But I feel like so many women are so scared in those early postpartum days and weeks of, oh my gosh, I feel like everything's falling out and I see something and what do I do? And they want to run to the hospital, and it's like, okay, wait. Take a breath. Let's talk about what's going on. Let's, read the room, read the symptoms. Will you talk a little bit about that and what your approach is?
Yeah, and postpartum, I mean, I start working with some of my moms very early postpartum. I mean, I just saw one last week who was 12 hours postpartum. And so we can start working on all sorts of things pretty quickly after. We're not doing internal work. So internal work isn't until 6 weeks. Everything's healing. We've got all the clearance and stuff. But in those first 6 weeks, it's actually really important to be addressing things like posture and body mechanics. So if we're thinking about that tube of toothpaste again, if we're slouching all the time, we're rolling that tube of toothpaste. And so there's constant pressure down on our poor pelvic floor muscles that just went through a big event. And so our pelvic floor is just trying to figure out where it lives again, how it works again. Sometimes it doesn't figure out how it works until we help it figure out how it works. And so we need to be mindful of how we're moving, what our posture is, especially in those first few weeks. So posture, body mechanics, toileting is a really, really, really important thing that we just don't think about. And so every time, if we're pushing and straining to have a bowel movement, we're pushing those organs down. And moms are the worst. We're normally in a rush. And so a lot of moms are pushing to pee. And so they're like, go, go, go. We've got to hurry. I have a crying baby over here. And so that pushing will keep pushing all of our organs down. So those are 3 daily things that everyone should be paying attention to, but especially my moms with potential prolapse, maybe a family history of prolapse. Those are daily things we have to be paying attention to. In that early postpartum phase too, there's a lot going on down here. And this is a conversation I have with so many of my moms where in general, most of us probably haven't really looked down here much. A lot of moms never looked down here before they had a baby. And so now they're looking for the first time and they're just like, oh my gosh, what's going on? What is this? What's that? And I actually just had a mom yesterday where she's just like, I was feeling in there and I definitely feel like there are some lumps and something's coming down. And once I explained the anatomy and I was just like, what you're feeling is actually your urethra. So it's perfectly normal. It can feel like penne pasta. So it's like a little bump that's towards the front. And she's just like, oh, that's exactly what it feels like. I'm just like, yep, organs aren't falling out. That's just normal anatomy. That's your urethra. And then from the back, we've got the rectum. Sometimes it's a little more squishy. If you are constipated, we might actually feel the stool in there. And that's not a prolapse. That's just that we're feeling the organ there and totally normal. The other big thing that gets a lot of my moms is when they have, can you hear me?
Yeah, you're good. We're back.
Oh, okay. The other thing that can happen is we might have vaginal rugae that's showing where it kind of looks like little skin tags. And so there's like, oh my gosh, what is this? There's something that's there that I've never seen before. And before we had babies, a lot of times our vaginal opening is very closed. We don't see in there. And so then when we're looking and we're opening our labias and our vagina is more open, we can actually see the lining or the folds of the vagina. That's totally normal. And so those are some of the things that freak a lot of moms out, where it's normal anatomy and it's nothing to worry about. Now for bladder, if the bladder is starting to prolapse, I say it kind of looks like brains. And so you'll see it towards the front. It can come down. It also maybe kind of looks like testicles too. So it kind of has that like wrinkly appearance. A lot of times that can be the bladder. If the cervix is coming down, sometimes it'll look more like a little donut. And so a little round donut. If the rectum's coming forward, that a lot of times just looks like bulging tissue from the back, but it's smooth. So those are the 3 big things that we might see if there is an actual prolapse or the organs are coming down. In those instances, I'm very conservative with prolapse. With my son, he was asynclitic. I pushed for over 4 hours with him. I was already a pelvic PT. I knew that could set me up for prolapse with prolonged pushing. So my postpartum, I spent in bed. When I got out of bed, if I took a shower, it was 5 minutes tops. I was in, I was out, I was back in bed, my pelvis was up because I didn't want gravity continuing to push my organs down. So I was very conservative about how long I was on my feet for. I wouldn't recommend going for walks right away. I definitely would not run. I had a mom years ago who was an endurance runner, and she, at 1 week postpartum, ran 8 miles, and her organs prolapsed. Her bladder fell out. And these are the things that I see because nobody's educated about this. She didn't know that she couldn't run. I don't think most people would want to run at 1 week. But she didn't know. And so impact activities are things that I would just wait longer on if there could be potential prolapse. Getting into that gravity assisted position, so a bridge where gravity can help to pull everything up, can be really helpful too.
Okay, so when it comes to those common complaints in postpartum, um, is there a window that is more ideal for helping to promote healing? I ask because so many times as moms, whether we're new moms or whether it's our fourth baby, life is busy and we don't prioritize ourselves at all, right? Because our world is turned upside down. We've got this new person or multiple little people that need us. And so a lot of times, any type of self-care, especially that requires appointments and visits and being away from everyone that needs us, gets pushed to the wayside, right?
Yeah.
And I'm curious your take on, is it, should as moms we be educated and putting a stronger emphasis on addressing these issues sooner than later?
Yeah, I mean, the sooner that you address anything, the faster it's going to heal. So we do want to get on it early. Now, with that being said, it's never too late. So I treat grandmas my oldest patient was 95 years old, who was peeing her pants, and we fixed that. And so it's never too late to fix everything, but it's much better to fix it like right away if we can. I would say scar tissue, we're working on a time range with that. So after the 6 weeks, assuming it's all healing well, I would like to get on it pretty quickly after that. Ideally, we really want to get on scar tissue before that year mark. So it takes about a year to go through all of its healing phases. So if we can get to it before the year, then we can have much more effective changes to that scar tissue. It goes faster. And so a lot of times that's one where I really think I love to get on it ideally well before it reaches that year mark of healing. And then muscular wise, it takes a long time for muscles to strengthen. So we have to be really patient with muscles. Now, this is where I think we can start with all of our pelvic floor, our transverse abdominis, our stabilizing muscles. We can start all of that day one if we want to, because functionally we have to use these muscles to lift our baby, to roll in bed, to go from sit to stand. So these are functional muscles that we need to use well before 6 weeks. So there's no reason that we can't start to engage and activate those muscles day one. You're not going to be doing crunches. We're not going to be doing all these crazy, more challenging, aggressive exercises for this. We're just going to be doing a gentle squeeze, zip her up, fully relax. Let's find that mind-body connection again. Let's get these muscles activated and working so that then we can have a head start. So when we get that clearance at 6 weeks for exercise, we're starting with a better base. And so it typically takes about 8 to 12 weeks of regular, consistent exercise for our muscles to start improving in our strength, tone, and endurance. So if we can use those first 6 weeks to start getting that foundation, then we can start progressing faster when we are cleared for exercise.
I love that. I remember after my third child was born, I discovered an app called Every Mother, and it went over that exactly, that starting on day one, let's start our breathing exercises and that mind-body connection. And it made such a difference. And I didn't realize how challenging that alone was going to be. And so talking on that and talking on, getting back into exercise, are there resources that you share with clients or exercises alongside the breathing to help earlier on before they get to that 6 week mark?
Yeah, so Every Mother is actually an app that I highly recommend.
Awesome.
There are a couple of apps that I personally like, where I like a couple of them. I know who made them. I know their thoughts behind how we want to train our foundation and work from there. where I agree with their approach. Now it's a little tricky because I feel like there are a million programs that are targeted to moms. It's like every week I have a mom asking, oh, what do you think about this program? I'm just like, oh, that's another new one that I haven't heard of. And so it's hard to really track all these different postpartum programs. But some typical exercises that are going to be fine for most people to do in those first 6 weeks, doing just the breathing and getting that mind-body awareness. I normally cue for a Kegel, thinking about a marble at the opening of the vagina. You just think about grasping that marble, lifting it up towards the head. If you want to add a little bit of the abdomen, think about a little zipper from your pubic bone to your belly button, and then drop everything back down. And so that squeeze, release. I want that control. And if someone's having a hard time with the release, then we need to be focusing on that, because then as we gain strength and endurance and we start doing other exercises, I teach everyone to start with your pelvic floor. Think of your pelvic floor as the driver to your core, right? We want that cap on that tube of toothpaste before any type of exertion. And so even doing bicep curls, if we can do that grasp lift, then do the bicep curl, fully relax. Grasp, lift, lift, fully relax. And so getting that coordination beforehand is going to make it so you can go right back into whatever tempo you want when you start doing more challenging exercises. Marching or heel slides, so lying on your back, always again starting with that pelvic floor, grasp and lift, then lift one knee up, lower it back down, fully relax. Grasp, lift the other knee up, fully relax it back. And so marching can be great. Heel slides, you're just going to straighten the leg, slide that heel along the bed, squeeze as you bend the knee back up. Bridges can be pretty good in that lying down, knees bent, grasp, lift the pelvis up, lower it back down. Things like bird dog can be fine. You might have to start on hands and knees where you engage that core, and then maybe you just lift one arm up and lower it back down, lift the other arm up, and then maybe you try to engage and lift one leg up, lower it back down. That might be pretty hard. You might be pretty wobbly with that. And so we can start with some of these more foundational exercises, getting some of that core starting to activate. But man, exercise postpartum is very humbling. And so these things that you think would be so easy, to do them right can actually be really challenging.
Absolutely. So now let's say someone's at that 6 to 8 week mark. Things have been going pretty smoothly. What are your biggest recommendations for starting to get back into a more air quote normal exercise regimen? Because I find like people always want to go so hard. They want to go back to pre-pregnancy, not even just like pregnancy working out. Like they want to get, a barbell on their shoulders. They want to get back to spin class. And I was like, whoa, no, you're going to hurt yourself. Take it easy. What are your recommendations for easing back into a normal regimen?
Yeah, we do need to ease back into it. We should be thinking about this postpartum period as a rehab period. It shouldn't just be like, oh, we have this magical 6-week mark and now your muscles are great. No, we went through all of pregnancy. Our muscles were changing during pregnancy. And a lot of times we did have to tone it down a little bit during pregnancy. Our muscles were super stretched. Now they're all trying to figure out how they work again when they're like a little bit more in their anatomical position. And so we should be looking at this as a rehab. So we had those 9 months of changes to our body. Now we had the 6 weeks of being pretty sedentary. And so what's crazy about muscles is that with 72 hours of disuse, so 3 days, 72 hours, we can have muscle atrophy. That means that the muscles literally shrink. And so during the postpartum period, we can lose a lot of our muscle strength and endurance. And so we need to think about that when we start back at exercise. because then it's going to take another 2 to 3 months to just start improving in the strength. So I think really starting slow, really starting with the foundation is the first thing to do. And maybe we start with like body weight exercises versus lifting really heavy weights. Or we start with really light weights. Make sure that our form is on point. Make sure that our posture is perfect. I always say postpartum, this is our chance. We kind of have a blank slate. Let's start by training all these muscles right. Let's activate the right muscles to come in so that now your exercise routine and everything in the future, you have a really solid foundation to begin with. I would not typically recommend starting with running or jumping. So impact activities, I would highly recommend waiting a few months. Just because we want to make sure that this pelvic floor is strong enough to be able to handle all that impact. There's so much pressure down on these poor muscles with impact. And so in those first few weeks, instead of jumping jacks, maybe you're doing step outs. If you're normally running, maybe you go on an elliptical instead for a little bit, or just start going for walks. And then we slowly, gradually put in the impact, and we have to go by how it feels too. So much, I tell my moms, go back to what exercises you want to start doing. I also don't think that there's a one size fits all, like everyone should do Pilates postpartum. I think Pilates is a great option to do postpartum, but some people hate Pilates. And so I want you to do exercises that you like to do. We just might have to do a watered down version to begin with. It doesn't mean we can never get to much more challenging exercises. It just means we've got to do it right. Take those foundational steps to work our way back up to it. And so the 3 things that I have my moms pay attention to and listening to their body when they're exercising is if you have any pain, if you pee your pants, or if you have pelvic pressure. Those are all signs that your pelvic floor is not handling what you're doing. And so we need to tone it down a little bit, do it where we can be symptom free, and then work our way back up. The other thing, if you lose your form, that's another one. You just aren't ready to do that. A big one is if your belly, so if you're looking at your abdomen and it's pushing out, so it's bulging instead of having that nice little drawing in towards the spine. If you bulge, you're not using your core. So you're using just intra-abdominal pressure to do the movement that you are trying to do instead of actually using those core muscles. And I've seen moms where they contacted me maybe 6 months postpartum and they're just like, oh, I started working out and I was doing all this ab work and I feel like my belly's actually getting bigger. And I have them show me what they're doing, and sure enough, everything they're doing, they're pushing their abdomen out. And so we just need to retrain, get that pelvic floor in, get that right transverse abdominis activation, and then do the movement.
Such great advice. I want to jump in really quick. I know I'm jumping all over the place, but I want to talk about VBACs. So for preparation with a VBAC, and going back to talking about the scarring and all of that, what are your biggest words of advice to prepare for a successful VBAC?
Yeah, so ideally we get working on that scar tissue right after the C-section to begin with, so that we get pretty aggressive on that scar tissue. And so we want it to be able to lift, roll. We want it really nice and mobile. If we haven't had that opportunity and someone's already pregnant, I would still be trying to massage that scar tissue, still try to lift it, so that any potential adhesions we can kind of try to take care of beforehand. And then really prepping the pelvic floor and the pelvis, making sure that everything has that mobility that we need. So we can prep quite similarly as someone who hasn't had a C-section before. We just have that added layer of maybe we need to be doing that lift and roll of that scar tissue right above that pubic bone.
Awesome. Okay, so myths and misconceptions. What are some of the biggest myths about pelvic floor health that you wish more people understood?
So back when I first was a pelvic PT, so like 15 years ago, the messaging around the pelvic floor was do your Kegels, do hundreds of Kegels every day. That's going to fix every problem you have with your pelvic floor. And that messaging is not correct. For some people, Kegels are going to help, and for others, it'll actually make their symptoms worse. So things like pain with sex, a lot of times that's from muscles that are too tight. If you keep tightening an already tight muscle, that's just going to make it tighter, and then you're going to have more pain. And so the number of moms who I saw where they would go to pelvic PTs that actually didn't do any internal work, had no idea what their pelvic floor was doing, and all they were doing was having them do Kegels, and then sex got even more painful. Once I explained to them what was going on, they're just like, oh my gosh, well, that wouldn't make sense to keep trying to tighten an already tight muscle. And so I think that's one big myth that's out there. Now, I also feel like we've swung too far the other way too, especially during pregnancy, because some people are told like, oh, don't ever do Kegels when you're pregnant because you don't want it too tight. And that's not what we want either. And so we need these muscles to work. So that's one of the other big ones.
I noticed that a lot of people, especially with like older generations, they joke about like, oh, well, just wait till you have kids and you do jumping jacks, or you jump and you pee yourself. And there's this programming of, incontinence, pain, because everyone's, always so scared about sex the first time after having a kid. And, prolapse is just a part that we need to normalize as, a part of the journey of childbirth. And that just drives me wild because I feel like that's just so not true. So can you talk a little bit about why, I know we've talked about the muscles and ligaments and everything, but why that's not true and how we need to denormalize like this idea that, albeit common does not equate to normal.
Yeah, and that, I think part of it is because one, the older generation didn't have access to pelvic PT. It's still like not that common of a profession. There are a lot more of us than there used to be. But that generation, they weren't told they could do anything. And so they've just been living with these symptoms. They had no education, no resources to tell them otherwise. And a lot of our medical community has continued that, right? A lot of doctors are just like, oh yeah, that's just what happens when you have a baby. And so our, not only have culturally we've normalized this, but a lot of it, like typical medical professionals have also normalized these symptoms, which then just makes women think, oh, well, I guess I just have to live with it. So then no one pursues any resources to help them. So I think that's a big part of it. And it does, it is common. A lot of women have symptoms. And so I think because we just hear about it so often and women joke about it, we all just think that that's normal. I remember, related but unrelated, back in PT school, we talked about posture and about what an anatomical perfect posture looks like. And there was some research that was done that was saying that it's normal. They were looking at a group of people to look at their posture, and they had deemed that poor posture was normal because of the number of people who had that posture. And that's where it gets tricky, because we see it and hear about it so much that then we think, oh, well, that's just normal, when it's common, but that's not how it should be. And so I think the education around it is one of the biggest things. Now more and more moms talk about it. That's another thing. Like, the older generation also didn't talk about this stuff. I think the younger generation, 40s, 30s, 20s, like, we're much more open to talking about these things. And when you talk to other moms and you're just like, oh yeah, we tried sex and it hurt so bad. And then other moms are like, oh, it hurt for me too. I went and saw this pelvic PT and she fixed everything. And so now we're starting to get the talking amongst the moms of, oh, I can do something about this. And so I think we're heading in the right direction. We need to get our medical community on board though, because we're still really behind on that. And I think there's just a lack of information and education about it. I think that's the main driving cause on that front is there's just not enough time in med school and these different programs. They don't value these symptoms. And so they're not talked about. They're not educated about what the options are. And so I think that's one area we need to start having more awareness so that then more women can be referred when they tell their doctor, like, oh yeah, when I sneeze, I leak a little bit, instead of just being told, yep, that's what happens. Welcome to postpartum. They could be like, actually, that's not normal. We can do things about it, and you can go see a pelvic floor physical therapist and they can help you.
Yeah, it's crazy to me. I'm thankful for social media in that regard, that it has helped to be a safe place, so to speak, for people to gather some information. But of course, it can also be incorrect information sometimes. But talking on the medical community side of things, I had a client recently who was within the Kaiser system. And prenatally, she had so many pelvic floor dysfunction symptoms. And it was so disheartening. And she was a first-time mom. And, it was like, oh my gosh, we need, like, from the very get-go, it was like, we need to get you in pelvic floor PT. But she really wanted to try to find, someone within the Kaiser system. And she was doing co-care at the time. And she spoke with the midwife, that she was seeing during her co-care appointments. And that midwife was so dismissive and just said, oh no, maybe it's the incontinence is in part to a UTI. And so instead of writing her referral, she went down the route of trying to diagnose a UTI. And I'm not kidding. I think it was 5 times of her pushing back and insisting on seeing a pelvic floor PT. They wrote her a referral, but then they wouldn't see her. They didn't have availability for her until like months after her due date. And it was so disheartening and this woman, she was persistent. She was extremely persistent. And the lack of accessibility, even when she was trying, and, it's a system that's supposed to be all inclusive, so to speak, was so sad because she wanted to, do the right thing to help her body, to help the birth, to help all the things, and still not having, the right resources and education and assistance was so sad to watch. But yeah, I'm hoping that with the mixture of all the things, being of a generation where we're more open to talk to each other about what was once deemed taboo topics, or having access to social media or YouTube and online resources, and you can feel safe of not, if you're not a super open person, to have this place to look for some of these assistance. And in a post-COVID world, I feel like certain providers are now more open to doing telehealth. And although it may not be an in-person internal exam, hopefully that's also helped to broaden the accessibility, at least for some. Real quick, because I know I'm running short on time. I want to be respectful. We're recording this on an evening weekday, and we're both moms with kids and families. But we had talked a little bit about the mind-body connection, and I'm a huge geek on that when it comes to the relation to pregnancy, to birth, to motherhood, all of it. How do you feel trauma, whether it's physical or emotional, affects the pelvic floor, and how does therapy and sessions with you play a role in the healing process, both, again, physically and emotionally?
Yeah, and both physical and emotional trauma a lot of times just leads to tension, guarding, protection. So these pelvic floor muscles, we don't see them and we just typically aren't aware of them to even notice that we're going into tension. And so I would say that's one of the most common things that I see. So just like how a lot of times we know, okay, we tense our jaws or our shoulders under stress. If we're stressed, we tend to tense here. A lot of women are tensing down here. And so getting the awareness there is really big so that you can even notice that you're doing it. And any muscle, if there is trauma to the body, I mean, and especially sexual trauma, this is right where it happened. And so that's where we can go into this protection guarding. And with that, all of this tightness here, that is typically going to lead to things like pain or more tearing. So those types of things. So we normally need to be doing some of the manual releasing. And I've worked with a lot of trauma patients where we just have to go really slow because our body holds on to trauma. And as we release some of the physical spots where we're holding on to it, we can also have an emotional release. This happens for scar tissue too. I mean, there are plenty of moms with C-section scars where once we start massaging the scar, they just start crying. And they're just like, I don't know why I'm crying, but my body's just like releasing. I'm just like, yeah, this is exactly what your body needs. So we hold on to some of these traumas through scar tissue and muscle tension. And so as you do the manual releasing of them, we can have some of these emotional releases. And I've had so many moms where afterwards they're just like, gosh, I just feel so much lighter. I feel like a weight was lifted off of my shoulders. And so not only are we helping with some of like the mental recovery of some of that, we're helping with the physical recovery. And so it's all connected. And so the trauma response is a big one. And then we need to train it. So some of these moms have so much tension, they have no idea how to relax their muscles. They couldn't relax their muscles for the life of them because those muscles have been so tight. And so we have to physically relax the muscles so they can actually feel what a relaxed position feels like. And so once they get that, and they're just like, oh yeah, okay, so it feels lighter, it feels softer. And then I have them do check-ins throughout the day because muscle memory, those muscles are going to go back into tension. And so they're checking in and then they notice, oh yeah, it feels like it's gripping again. Okay, let's drop that marble back down. And so doing that repetition over and over where they're recognizing the tension when it's happening and then they're releasing it, that's how we get it to come down and stay down. And that goes for any tension, but I mean, that's what we typically see with trauma.
Right. Absolutely. We see that in my world as well. And even if there's a trauma that was not disclosed, upon the intake and throughout the pregnancy, we'll see that in birth. And I try to be super mindful on talking with my clients when they first come to care to just kind of lay that groundwork that like, hey, this is the statistic. And in our line of work, we see it way more common than what, the studies say and the papers say, right? Because going through something like an unmedicated childbirth, it can be very triggering if that emotional and physical work is not done prior. And I find it extremely fascinating that when you feel safe to, be able to verbalize what has occurred and, the physical symptoms that you experience, whether it be with intimacy, whether it be with exploring your own body, right? Or even more physical symptoms as well because of the tension that is going on. Once you start to feel in a safe place to verbalize that and then be open to the idea of, maybe pelvic floor PT, because as a survivor, that feels so scary and that feels so vulnerable. And I see it all the time that like I'm recommending and just like, nope, no, not penetrating this wall of suggestion. Right. But I hear the feedback on those that do allow themselves to go through it, and not just obviously the physical relief they're feeling, but that lightness that you explained. It is so beautiful to watch them come back in and to just tell me. It almost is as if it was empowering to them, to be able to let go and to feel safe and to have the relief of whatever physical symptoms they were experiencing, to be able to experience intimacy with their partner and not know that they're guarding, it is so amazing. And then in turn to see the impacts on the birth and, how that played a role in it too. So just to talk on that for those listening, if, there is a history of emotional, especially physical trauma, while pelvic floor PT, especially internal work, can feel so scary, it can be so healing and it can be so helpful. Because the other thing too, having worked with Whitney personally too, it's what I love about you so much, Whitney, is obviously you're just the sweetest energy and you're just so loving and kind, but you're so gentle and you take your time. And I have heard horror stories of other pelvic floor PTs that aren't mindful of just the fact of how intimate the work is, because maybe perhaps it's become very checklisty for them. And same thing with me when I'm doing any sort of vaginal exam, any sort of cervical exam, anything internal, I'm making sure that you are aware you're in control here. At any moment you want me to stop, we're stopping. We're going to go slow. Is it okay to proceed? And in my work with you, I felt that same tenderness and care. And that's so important, and just it can be so healing in itself. So just wanted to touch on that for a minute. But
and that was actually one of the things too that I would have also pointed out is, I've heard the horror stories from some of my patients too, of them going to a provider that just went right in or didn't make them feel comfortable. And that is something that I would advise everyone. If you're starting to work with a pelvic floor physical therapist and you just don't feel comfortable, or maybe something just feels off, don't do the internal. You can say no. You can say, let's do this another time. You are in control. So you should always feel like you have the control. You should also, your pelvic floor PT should be explaining everything before you do anything as well. And I have my moms, when I know that there's a trauma history, I give them the option and I say, you've gone through a lot. Your muscles might be tensing a lot. This isn't going to be like a walk in the park for you. And so maybe we're just going to start with putting a little pressure on your sit bone. And then we see how that goes. And if you already feel like you're tensing, you're sweating, you're feeling faint, then we don't go any farther than that. We're going to wait until your body is ready for us to do more. And we have to respect what our body's telling us. And so any of those types of reactions, that's when we need to say, okay, we're going to take a little break right now. We're going to do something else. We can come back to it when we're ready. And I think too many practitioners are just like, go, go, go. We just got to get this done. Suck it up. And it's like, that's not the right approach. So you should always feel really comfortable with the practitioner that you're working with.
100%. That is such a good point on reminding, clients and patients to listen to their own bodies as well, because I have seen it in my own work as well, where someone, whatever it may be, maybe it's for a pap smear, maybe it is for a cervical exam, maybe it's for a membrane sweep. I don't recommend internal work in my work often. It's usually because we have a purpose, right? Or we're game planning something. But I've seen it so many times where someone is verbalizing consent and saying, yeah, just do it. But their body is screaming no, to where for someone like me who tries to be very intentional and mindful as a practitioner, it makes me uncomfortable, and it's like, no, we have to honor that the body does keep score. It stores experiences, even ones that we might not cognitively remember, and to respect that. So like you're saying, if you are breaking out in a sweat, if you're having racing thoughts, if you feel your heart starting to race, you feel your body internally clutching down, gripping, those are signs that this is perhaps not the right time for this type of treatment. So I love that you touched on that, because I feel like too many times if we do put ourselves in those positions to open up for an internal exam of whatever sort, we try to like trick our body into, giving consent, because, in our brain, we're like, we're already here. We have to do it. And it's like, no, you never have to do those things. So, I appreciate you so much, Whitney, for taking the time. So for those that don't have access or, resources available to them for in-person pelvic floor PT, what are some of the first steps that you recommend someone to take, with what they're experiencing?
Yeah, so there are different programs, of course, online. You can take some and leave some. Some of the big things is seeing if you can do some of your own little exploring to see what you feel. I do telehealth. I also have a couple of online courses too that like walks through how to do everything. It's all like a how-to on yourself, so that you can start doing some of the work on your own. Of course, a lot of moms are like, gosh, I just don't know what I'm feeling. So if there is someone that can do the internal work and give you feedback, that's of course most ideal. But that's what I would do is take a look at some of the resources of things that you can do for yourself. I know I have a couple of my recorded classes. I'm always happy to help people virtually as well. Yeah.
Wonderful. And where can our listeners find more about you and get connected with you and your work?
Yeah, so on Instagram, it's at Restored Physique. So I have all sorts of posts on there for tips and tricks of pregnancy and labor, postpartum. I have some pediatric pelvic floor posts. And so there's a lot of information there. My website is restoredphysique.com. So those would be the best ways to check out my stuff.
Wonderful. And I remember that up until recently, you offer occasional free online like live classes. Are you still doing that?
Mm-hmm. Yeah, I just did one last week.
Awesome.
I'm doing them more as on like a quarterly basis.
Okay, cool. Well, thank you again so much, Whitney. You are such a wealth of knowledge and such a wonderful resource to our community. And I appreciate you for taking the time to share just a little sliver of what you know and what you do.
Thanks. It's my pleasure.
For all of our listeners, and we will see you guys soon. Bye. Thank you for joining me on this journey of growth, connection, and conscious living. If you found value in today's episode, share it with someone you love, and don't forget to subscribe so you never miss a moment. Follow me on Instagram at Gold Soul Midwifery and sign up for the newsletter to stay connected and in the loop. Until next time, stay grounded, keep growing, and remember, your gold soul shines brightest through the beautiful and messy moments of life.